Here are some common questions that may be asked in an NHS nursing interview and strong sample responses. 1. Why do you want to work as a nurse for the NHS? I am deeply committed to the values of compassionate care and equal treatment that the NHS represents. My skills and experience align well with this role, and I am eager to make a positive impact caring for my community. 2. What are your strengths and weaknesses as a nurse? My key strengths are patient advocacy, attention to detail, stamina during long shifts, and remaining calm under pressure. One area I strive to improve is in delegating tasks when the workload gets heavy. 3. How do you ensure you provide culturally competent care? I actively listen to understand patients' diverse needs and perspectives. I participate in training on implicit bias and delivering inclusive care. I advocate for patients who feel marginalized. 4. How do you respond when a patient or family member is angry? I listen calmly without getting defensive. I apologize for their experience. I focus on understanding their frustration and finding a resolution. If needed, I will consult colleagues to address concerns. 5. How do you prioritize tasks when you have a difficult workload? I categorize tasks based on urgency, starting with anything that affects patient safety and care needs. I communicate delays clearly and ask colleagues for help balancing priorities when necessary. 6. Can you share an example of going above and beyond for a patient? When we were short-staffed one night, I stayed an hour past my shift to sit with a patient who was anxious about an upcoming surgery. My extra time reassured them. 7. What do you do if you disagree with a doctor's care order? I would discuss my concern professionally in private with the physician. If needed, I would elevate the issue to the charge nurse or nursing manager to determine the correct care plan. 8. How do you respond when a patient asks for a service or treatment that may be unsafe or unethical? I explain why we cannot provide the requested care, apologizing for any inconvenience. I educate them on alternatives that are safe and ethical. If they insist, I will need to elevate the request. 9. How do you stay up to date on medical knowledge and nursing best practices? I regularly read nursing journals, take CE courses annually, attend conferences when I can, and discuss developments with colleagues. I'm also pursuing my master's degree. 10. Tell me about a time you made a mistake at work. How did you handle it? When I missed a dose of a patient's medication, I immediately notified the physician and charge nurse per policy. I apologized and monitored the patient closely for side effects. I learned to double-check all drug charts. 11. How do you promote patient safety on your unit or ward? I follow all protocols to reduce risk. I speak up when processes seem unsafe. I identify hazards. I also encourage patients to take an active role in their care by asking questions. 12. How do you respond when a colleague does not complete their assigned tasks? I kindly offer help if they are overwhelmed. If not, I will have a constructive discussion focused on workload expectations, obstacles, and solutions. If issues continue, I involve our manager. 13. How do you build rapport and communicate with patients who have mental health conditions, dementia, or other challenges? I speak slowly and calmly, making eye contact and using nonverbal cues. I give them my full attention and look for any signs of agitation. I keep questions simple and confirm understanding. 14. Tell me about a time you successfully delegated tasks to nursing assistants or technicians. When admissions doubled one day, I had NAs take vitals and EKGs for new patients so I could prioritize complex wound care. My clear instructions ensured tasks were completed properly. 15. What qualities do you believe are most important in a nurse? Compassion, meticulous attention to detail, critical thinking skills, stamina, and effective communication/teamwork are all crucial. A nurse must also have unquestionable integrity. 16. How do you build positive relationships with patients and earn their trust? I introduce myself warmly, listen closely to their concerns, and encourage questions. I explain each step of their care and follow through reliably. I maintain professional but friendly rapport. 17. What do you find most rewarding about being a nurse? Making a positive difference for patients and families on their worst days or during vulnerable moments. I'm motivated by helping guide people through difficult health challenges. 18. How do you respond when patients or family members are rude or abusive? I remain calm and professional, setting clear expectations about respectful communication. If issues persist, I involve my charge nurse or security as needed, always focusing on compassionate care. 19. Tell me about a time you had to adapt quickly to a challenging situation at work. When we had an influx of car crash victims in the ER, I coordinated stationing extra staff at triage and clearing beds to handle the surge efficiently. My adaptability helped us respond. 20. Do you have any questions for me about this role or our hospital? What types of professional development opportunities are available? How is patient feedback utilized to improve care? What do you enjoy most about working here as a nurse manager?